So, can you tell us a little bit more about your journey into private medical practice and when did you decide to take that leap?
So I was appointed as a consultant gynaecologist at Bart's in 2018, and within 6 months of starting my NHS job, I was approached by London Clinic to apply for privileges there, which I was fortunate enough to start my journey. And I I really like the variety of patients and with their problems that I see in the private sector, because a majority of my patients in the private sector are worried about genuine health conditions, whereas majority of my patients in the NHS have got diagnosed cancer. So it's a completely different cohort that I'm looking into. And thereafter, slowly, I've started establishing my practice as a cancer surgeon. And now I'm seeing more proportion of patients having diagnosed with cancer that need treatment under my care.
So, what were the biggest challenges that you faced when you're starting up your private medical practice, and how did you personally overcome them?
One of the biggest challenges was that I was starting afresh, and probably visibility is a major factor in getting referrals. At the time, I was working with a group practice, so the group within the group there were onward referrals related to my subspecialty, and then slowly building over from them, I started independently and I engaged with other healthcare professionals. I gave talks, and that just improved the visibility as well as the number of referrals that were coming through the practice.
So, in today's digital age, how important is marketing to your practice's growth, and what methods or platforms have been the most effective for promoting your gynecology practice?
That's a very pertinent question, because you have to look at the client base, and patients nowadays are googling whom they want to go and see. They look at your profile online. They even look at what other people have said about you. So feedback from other patients. I think it's important to have a website, other channels of disseminating information, like having online presence through Instagram. I've done some videos in the past over TikTok, which have just informational videos regarding health conditions, which has really helped and has positive response. I think it's important to engage with social media and have an online presence, because that's how the patients are looking to find information. And if you appear to be sort of approachable, I think that is works in your favor.
What challenges were you facing in your marketing efforts before you started to work with us? And what were the things that you were looking to really move the needle in your private medical practice?
Marketing has always been a challenge, because as healthcare professional, we know very little about marketing. It's always a word of mouth that brings you patients, and it was very important for me to engage with a group like yours to get that marketing aspect to my private practice more visible online, and also have a working website. So really thank you for that. I can see how much work has been put in the website.
Yeah, amazing, awesome. And I just out of interest, as a side question, I guess why did you choose to work with like myself and the team at Allied Health Media?
I found you through social media, and one of the triggering factors was that one of my urology colleagues did a short video with you. And so I just thought, if he has done it and he's found it useful, it's relevant to my practice, and that's how I connected. And I'm glad I did that.
How do you see the role of artificial intelligence or other emerging technologies transforming medical practice in the next coming years?
Artificial intelligence is the future of almost all fields, and we already see a major impact of artificial intelligence in healthcare, such that we've started using robots to assist surgery. There is interactive and intuitive systems built in robotics, where it guides the surgeon appropriately. Also, in diagnostics, there's a lot of AI intervention in terms of diagnostics, like radiology and pathology. So we've got to embrace the technology. There are There are limitations at the moment, and I can see that it's going to be a big part of our working environment in future.
Yeah. Any specific examples that you've seen that you think will that's been really helpful now, or you think will become more helpful over time?
So, for example, now we have embraced assisted surgery for challenging and complex patients. It's a minimally invasive approach, and they are already benefiting it. So, robotic surgery for early stage endometrial cancer is a standard of care now. We have introduced sentinel lymph node detection for endometrial cancer, and that's based on AI technology. AI technology with superimposition of CT scan images is going to be the next step in robotic surgery, where the surgeon will be guided to the target organ, and important organs will be highlighted during the surgery. So that's the next step, I think. And I can already see platforms building on that AI based surgical approach.
So, do you see any upcoming trends in the medical field and the private medical field that you feel like will shape the future of prior practices?
Yeah, one of the exciting developments in oncology itself is targeted treatment. So, how we individualize treatment for a particular person has always been a challenge, because cancer treatments have been standard and not everything fits in for one person, and we've got to individualize it. So, one of the exciting build-ups is using genomics in cancer treatment, and I think that's slowly coming into routine practice now, of how we target a particular cancer based on the genomic structure of the cancer, the tumor profile, and also then look at a particular individual and look at the patient factors. So I think that is the most exciting aspect in particularly my field, oncology.
Have you made in developing and growing your private medical practice, and what did you learn from those?
That's a very good question. I think to build up a private practice, you need a good team. Uh, in the initial part of my private practice, I was really struggling with admin and secretarial support, and I think that I made a financial mistake along those lines, and now over the last 6 to 8 months, I've got better support, and I can already see that whatever I've invested in is going to is better for the practice in terms of patients finding it positive, and also for me to have that support is valuable. And also, I was very reluctant to enter marketing, which I think was a mistake, and I can see that that was a mistake now that I've met you. So I would strongly suggest that the two most important things for the private practice, secretary, your admin support as well as marketing, we should not disregard these important pillars.
So, what's your approach to delegating tasks to ensure that your private medical practice operates efficiently?
So I make sure that if there is, it depends on the priority of the task. So if it's really urgent, I pick up the phone. For example, if a patient needs urgent assessment by a colleague, I pick up the phone to the colleague and say, "This is the problem. Please can you help?" Otherwise, for less important or less urgent tasks, I would ask my secretary or PA to do it. We've got nurse specialists in the hospital who can help with certain tasks. So it depends on what the priority of the task is, what the clinical needs are for the patient, and delegating to the appropriate person is important, because I can delegate certain tasks to my PA. I can delegate certain clinical tasks to my clinical nurse specialist, and it's important to recognize the boundaries.
How do you build and maintain a strong team, both internally and externally? And what qualities do you look for in staff and other medical professionals and third party companies like myself who are looking to help you grow your private practice? What are the qualities that you're looking for in these types of people?
The most important qualities to build up a strong team are: number one, they should be approachable and they should be available. Because if you're not approachable or available, then you're not going to be part of the team. And the other important aspect is we need to recognize each other's strong points and negative points and build boundaries. Because if we understand each other well, then obviously, like any team sport, say cricket, everybody's got their own skills, but they work together to score those many runs or take those many wickets. And it's the same thing we do in day-to-day healthcare. We need to recognize each other's skills and work together. But approachable and available are the most important thing.
How do you establish yourself as an authority in your medical specialty to ensure that patients trust you wholeheartedly for their care?
It takes a number of years to build up trust within the medical community and the patient. So if I talk about my own practice, after completing my general obs-gynae training, I had to take a fellowship in specifically oncological surgery to attain subspecialist accreditation. And that was important because to work in a tertiary care hospital and to work with cancer patients providing appropriate care, training is important. So that's the first thing. You have to have appropriate training to be recognized as a key person in that field. Research is important. So we have a very active research department in our NHS base, and then be recognized in particular element of subspecialty. For example, I lead the ovarian cancer cytoreduction service and the pelvic exenteration service in my NHS hospital. And I'm recognized for those skills such that my colleagues from other hospitals or my colleagues from other departments would refer patients to us for that particular service. And it's a matter of building trust within the medical community, within your colleagues, and then patients. Once the patients are going through the journey, I mean, I've had patients for more than 10 years who are coming to see me for follow-up, and often we build that rapport such that after a while we are talking about what social activities they are doing and not about their medical health. And that's a journey. And being a key leader does not mean that you are the you know you have to be recognized worldwide, but it's important that you hold authority in certain skills and be respected and have a track of producing results repeatedly.
What is the long-term vision for your medical practice? Do you plan to expand to locations or perhaps maybe introduce new services in the future?
Yeah, so I've thought really hard about this, and over the last couple of years, there's a real need for having a oncological group, particularly in gynecological oncology. And in near future, my vision is to form a gynecological oncology group practice where incorporating different medical colleagues who can deliver the same level of care and have the same thinking. So that would include the surgeons, the pathologists, the radiologists, the medical oncologists, clinical oncologists. I already work with reputable clinicians, and eventually, what I want to do is build up a practice where we have a group who can then deliver the same care that we do, but not in separate places, but build up a practice in one place. I see that happening in the next 5 years.